Diolch i chi am adael i fod rhan o'ch diwygiad blynyddol i ddathlu yr agoriaeth staff. Yn gyntaf, yr wyf am ymddiheurio am beidio a bod yn bresennol yn bersonol, ond ar ddydd Mawrth, yr wyf yn y Senedd. Thank you very much for letting me be part of your annual event to celebrate staff excellence. To begin with, I want to apologise for not being able to be with you in person, but on Tuesdays, I'm always needed on the floor of the Senedd here in the Bay. I am, however, delighted to have this opportunity to contribute to a ceremony which recognises the hard work and dedication of the staff of Powys Teaching Health Board, regardless of whether they have won an award. I'm forever amazed by and thankful for the commitment and dedication of the staff who work for the National Health Service here in Wales. I can appreciate that at a time when the service is under so much scrutiny, it might create additional pressures for us all, but I can reassure you that I know we have an NHS that is something that the people of Wales value and want to protect for future generations. Now, Dr. Goodall has already referred to examples of innovative working in Powys, and it was here in February that the NHS core principles were launched. These principles were developed in partnership with Welsh Government, the NHS employers and the trade unions, and are the foundation of how staff across the NHS in Wales should work together. The core principles put the public and patients first and have been developed to ensure the NHS delivers the best possible care to those with the greatest health needs first. They also put an emphasis on well-being and preventative healthcare and in supporting NHS employees continuing professional development. NHS Wales continues to experience significant challenges at a time of real financial constraint. We have to focus on increasing demands on service provision while maintaining patient safety as our paramount concern. How can we do more with less money? That's the conundrum which we all face together. For Wales, we are working to achieve a prudent healthcare system. This relies on reimagining the workforce of the future and deploying our most precious resource, the people who work for it, according to that core healthcare principle which insists that no one should routinely be providing a service which does not require their level of clinical ability and expertise. We published our National Primary Care Plan for Wales, supported by a workforce plan to underpin it. An example of this is the movement of care closer to home and our plans for the primary care workforce, which was published last year. The plan outlines how we are investing in the training of a wider range of professionals who make up the primary care team, helping us to overcome some of the recruitment challenges which we know we face. For example, ensuring that the time and expertise of our most highly trained and expensive practitioners in the system, general practitioners themselves, can be freed up to concentrate on those patients for whom only the skills of a GP can provide a sufficient response. This is all so important because of all the fundamental strands in the Health Board's 3-year plans. The workforce is in many ways the most powerful tool we have in planning for the future. Remodelling the workforce remains in our collective hands, and in 2016 we have grasped that opportunity firmly. We need to work together in the best way we know so that we can achieve what we need to here in Wales in order to be in charge of our own future. Congratulations again to all those who have won awards this year. I would like also to relay personally my thanks to all of the Health Board's other staff. Your ongoing commitment to improving patient care is so much valued and appreciated. Good health is vital to the creation of a prosperous, successful and sustainable Wales. Hoffwn I ddiolch I bob un ohonoch chi am y gwasanaethau rydych chi'n ei wneud ac am eich ymroddiad parhaus. I'd like to thank each and every one of you for the difference that you make day in and day out, and for your continued dedication to the welfare and well-being of patients in Powys and right across Wales. Diolch yn fawr i chi gyd am wrando.